I like to see a hemoglobin higher than 11 to 11 and a half. But the reason that we want to optimize hemoglobin is that it is a factor in bringing oxygen and energy to all of our organs, including our brain. In children, especially children under the age of 2, their brain is still developing. We really want to optimize the hemoglobin because if it's too low, it may affect their intelligence down the road. But it's the first time we check is at around 6 months of age, and I like to see it higher than 11 to 11 and a half. It is very common to be low. Then we supplement with iron. You can give iron independently, or you can give a multivitamin with iron, and that may make it easier because during breastfeeding you also want to be supplementing with vitamin D. If I recommend iron supplementation, I always warn my patients that it can cause constipation and it can cause the poop to turn dark brown to very black. It can be given with food, but it should not be given close to a breastfeeding or a milk bottle. The reason for that is that milk binds the iron and it prevents it from absorbing. We usually continue the supplementation for 1 to 2 months and recheck the hemoglobin in 4 to 6 weeks to make sure that it's increased. If the baby is eating, we want to increase iron-rich foods, things like spinach and meats and beans, dark green leafy vegetables. You can puree them and blend them into their foods that they naturally eat. And then we want to decrease the foods that may bind the iron and cause anemia. So increase in milk. After the age of 1, I like children to limit their milk to only 16 ounces a day. And after the age of 2, I like to decrease milk products to only 1 to 2 servings a day, which includes yogurt, cheese, and ice cream.